So, good afternoon, Excellencies, distinguished dignitaries, esteemed guests, ladies and gentlemen. On behalf of Embassy of India in Kuwait, I welcome you all to today's event, India, the Global Healthcare Destination. Today's event is broadly divided in two segments. In the first segment, we will celebrate the important milestone of India administering 1 billion COVID-19 vaccine doses. In the second segment, we'll have a moderated panel discussion, which will be followed by a breast screening camp run by nurses and doctors who have selflessly volunteered for this noble endeavor. This event is being organized by the Embassy in association with Indian Women's Network, IWN Kuwait, and the Indian Doctors Forum, IDF Kuwait. Today's event, in essence, is a continuation of Embassy's and the broader community's relentless fight against COVID-19. A number of events had been organized by the Embassy and are continuing to be organized by the Embassy on this important subject to generate awareness about COVID-19, including 2 roundtable discussions that the Embassy had held in association with Indian Doctors Forum, and also the COVID awareness campaigns, all of which witnessed massive participation and tremendous positive response. Before we begin the official proceedings of the day, may I request all the esteemed dignitaries who have joined us here in the auditorium to continue to follow all the COVID-19 related health and safety guidelines, including maintaining adequate safe social distancing. And I can see people are adjusting their masks. Yes, wearing your masks properly throughout the program. Thank you for your cooperation in this regard. Through this event, we now not only wish to celebrate today, the 21st day of October 2021, a day which will be remembered as a monumental day in the annals of our rich and cherished history. This is the day when our prowess in healthcare domain is for the world to see. This movement is the triumph of our collective ingenuity, our indomitable spirit, our resilience, and our collective perseverance. This achievement has beyond doubt placed India at the heart of global healthcare system and has also reaffirmed our numero uno position as the destination for medical travel. It is often said that a picture is better than 1,000 words, of course. So let us begin by watching a short video clip which beautifully encapsulates India's journey to reach the 1 billion COVID-19 landmark.
प्रधानमंत्री जी से अनुरोध है कि रिमोट बटन दबाकर विश्व के सबसे बड़े वैक्सीनेशन कार्यक्रम का औपचारिक प्रारंभ करने की कृपा करें।
Moving on, we will now have the traditional lamp lighting ceremony. May I now request the following dignitaries to come to the dais for the lamp lighting ceremony. His Excellency the Ambassador of India to Kuwait, Shri C.B. George, Madam Joyce Sibi, Dr. Amir Ahmed, President, Indian Doctors Forum. I thank all the esteemed dignitaries. While I request His Excellency to stay on the dais, I request the other dignitaries to take their respective seats in the auditorium. May I now invite His Excellency Ambassador of India to deliver the inaugural address, please. Welcome, sir.
President of Indian Doctors Forum, Dr. Amir Ahmed, senior doctors who are present here today with us, esteemed dignitaries, distinguished guests, ladies and gentlemen, my dear media representatives, good afternoon to all of you, and welcome to Embassy of India. I begin my address today by thanking His Highness Sheikh Nawaf Al Ahmad Al Jaber Al Sabah, Amir of the State of Kuwait, and His Highness Sheikh Mishad Al Ahmad Al Jaber Al Sabah, Crown Prince of the State of Kuwait, for hosting the large Indian community in Kuwait, and also for the care and support the government and the people of Kuwait extended to the Indian community during the COVID-19 pandemic. I am so happy to see that Kuwait is a success story in the effective handling of COVID-19 pandemic. The leadership here has acted with resolve during the unprecedented crisis. I congratulate the leadership, His Excellency Minister of Health, and all medical professionals, doctors and nurses who are part of the Ministry of Health, and of course, the people of Kuwait. Life in Kuwait is returning to near total normalcy. Congratulations, Kuwait. I am glad that our cooperation with the medical fraternity in the friendly state of Kuwait continues to grow strong. Our cooperation in medical sector is a key element in our multifaceted bilateral relationship, and this is truer now than ever when we jointly fight the COVID-19 pandemic. I congratulate Indian Doctors Forum, its President Dr. Amir Ahmed, and all its members, especially the panel of doctors who will conduct the symposium on an extremely important subject of breast cancer awareness today. I am sure that we will all go back to our homes better informed and would be in a better position to take necessary early measures for prevention, early detection, and cure, and thereby save the lives of our loved ones. I'm also happy to know that this program is on live and is being watched by a lot of our people in Kuwait and outside. I would like to thank the volunteers, both doctors and nurses, who will be organizing the week-long breast cancer screening camp at the embassy premises starting today. I would encourage all my sisters in Kuwait to use this opportunity and avail of this facility for their own good health and well-being, and that well-being of their loved ones back home. Let me reiterate what I have said before, which holds true even today. That is, IDF team is a trusted partner of the embassy. The team is always in the forefront of the efforts of the embassy in ensuring the welfare of the Indian community in Kuwait. Our partnership with IDF continues to grow, and I thank IDF not only for its humanitarian efforts, but also for its many endeavors in supporting the Indian community in its efforts to fight the pandemic. They have worked closely with the embassy in many activities, be it organization of dedicated seminars, awareness campaigns, roundtable discussions to educate people about COVID-19 pandemic, or by conducting medical camps for distressed nationals and offering free of charge teleconsultations, and now again through this breast cancer awareness campaign. Dear friends, today's event is part of our continuous efforts to contribute towards the ongoing fight against COVID-19. In fact, in our fight against COVID-19, today we have crossed a historic milestone. India has hit the vaccine century. We have, as on today, administered more than 100 crore, that is 1 billion. That is 1 billion COVID-19 vaccine doses. More than 75% of India's eligible population has received at least one vaccine dose. What is even more remarkable is that this 1 billion summit has been scaled in less than 40 weeks. This milestone exemplifies India's prowess in various elements in the vaccination journey: development of new vaccines, production of vaccines, deployment, and technology. The indomitable spirit of India's frontline health workers, the doctors, the nurses, the auxiliary nurse midwives, and the thousands of vaccinators who overcame challenges of terrain and weather to reach the remotest areas, ensuring that no one is left behind, has shown through helping us reach this 1 billion mark. Once again, we thank our doctors, our nurses, and other medical personnel for their phenomenal contribution in helping reach this landmark and for working day in and day out to save lives in our fight against the COVID-19 pandemic. The sheer expanse of the vaccination drive can be gauged from the fact that there are 313,000 vaccination centers across India. There are more than 246,000 vaccinators, and there are 740,000 trained personnel in the vaccination teams. 74% of the vaccination centers were in rural areas, accounting for 65% of the total coverage. How have we achieved this feat? Well, the hallmark of India's vaccination drive has been the clear vision, the right guidance, the high-level oversight, and impeccable coordination, particularly by Honorable Prime Minister himself. Our prioritization of vaccine development through launch of Mission COVID Suraksha is the reason behind India's vaccine development and production success. I am pleased to share that India is the only country in the world that has developed multiple vaccines across multiple platforms, be it the inactivated virus platform or the DNA-based vaccine, mRNA vaccine, or the viral vector vaccine. In fact, India developed the first DNA-based COVID vaccine, ZCoV-D, which will facilitate vaccination of children above 12 years of age. Another outstanding aspect of this 1 billion vaccine journey is that nearly all the 1 billion doses administered have been made in India. And more than 95% of vaccine administration has been done by the public health system, a testimony to its reach and robustness. Meticulous planning and effective use of infrastructure by leveraging on technological advancement in healthcare has made this achievement possible. Dear friends, I am pleased to inform you that all that India has acted with resolve during the unprecedented crisis. In India, the rate of spread of infections, the number of fatalities, and the number of cases requiring hospitalization and critical care have dropped drastically and are historical low today. An all country, all government approach has helped us overcome the two phases of peak infections in India. Prime Minister regularly addressed the state governments and the people directly, launching various programs aimed at taking this all India effort forward. Healthy infrastructure has been ramped up continuously as a precautionary measure. India's technological prowess is being leveraged to deliver much needed healthcare solutions. The CoWIN application, which forms the technology backbone of the vaccination program in India, is an example of the success of Digital India. Dear friends, while India implements these innovative solutions to combat the global pandemic, it keeps the needs of the international community at the center of its concerted efforts. The CoWIN platform has been designed on an open source platform for the benefit of all friendly countries around the world. I am pleased to inform that many countries around the world have expressed interest in leveraging from the global public good created by India. We have been doing this right from the start of the fight against COVID-19. Let me repeat. India extended medical and other assistance to more than 150 countries. India has sent essential drugs, testing kits, and other medical assistance to these countries. Medications made in India were shipped to destinations across the world in daunting logistical circumstances imposed by lockdowns. Indian rapid response teams were deployed in 8 countries, including in our friendly state of Kuwait. Indian naval vessels and Air Force airplanes delivered supplies along a wide arc of friends and partners. Through the Vaccine Maitri, the global health diplomacy operation, we have supplied vaccines, made in India vaccines, to more than 90 countries in the world, including again to our friendly state of Kuwait. Let me quote from the message of Honorable Minister of External Affairs, Dr. S. Jaishankar, who said today morning, and I quote, "Today, India has reached the milestone of 100 crores, 1 billion vaccinations. This is obviously central to our economic recovery and central to our public health. And the fact that we have been able to achieve such a massive exercise in such a short time is due to the vision and even more motivation provided by Honorable Prime Minister of India. From the external affairs perspective, what this means is that Indians will have much easier and freer access to the global workplace. It would also mean that more people from abroad would come to India, adding to our tourism flow, reviving our services and contributing to our economy. So this milestone is indeed a great achievement, and collectively as a nation, we should be proud of what we have achieved." Unquote. In his message, Honorable Prime Minister said, "India scripts history. We are witnessing the triumph of Indian science, enterprise, and collective spirit of 130 crore Indians. Congratulations, India, on crossing 100 crore, that is 1 billion vaccines. Gratitude to our doctors, nurses, and all those who work to achieve this feat." Unquote. Dear friends, coming to the other part of our today's event, I am so delighted to partner again with IDF and be part of an initiative which I strongly believe will be highly useful for everyone. I am honored to welcome you all to the Symposium on Breast Cancer Awareness that is being conducted and moderated by senior doctors from the Indian Doctors Forum, Kuwait, who are experts on this subject. Breast cancer is the most common form of cancer among women. Delayed detection and ignorance about the disease are the prominent reasons for fatalities. To realize the dream of Honorable Prime Minister of a fitter and healthier India, it is essential that we pay attention to preventive health care. It is therefore advisable for women to not only self-examine themselves but also undergo periodic health screenings to rule out any serious health issue, including cancer, which when detected earlier can be cured completely in most cases. Cancer is not a death sentence. A breast cancer diagnosis is not the end of life. It is the beginning of the struggle to regain control of our lives and a march towards healthier, productive, prosperous, and happier lives. This symposium and the week-long medical screening camp that is being organized today in association with IDF is an endeavor to encourage our sisters to not to be afraid of medical screenings for breast cancer. Today, screening will be held at the embassy premises. Tomorrow, it is held at the embassy shelter. And again, this will continue for at least a week in our premises. I once again congratulate IDF, the entire IDF team, its president, Dr. Amir Ahmad, and all members of IDF who are part of the awareness campaign. Best wishes to all of you. I now look forward to hearing from the panel of experts and other esteemed dignitaries who have joined us here today. Thank you and good afternoon.
Thank you very much, Your Excellency, for those insightful remarks which have now laid the framework or the roadmap for today's discussions and deliberations. Thank you also, sir, for providing a comprehensive overview of India's COVID-19 management and the global vaccine initiative. Ambassador just spoke about the message of Honorable External Affairs Minister, His Excellency Dr. S. Jaishankar. Let us watch the video clip.
Today, India has reached the milestone of 100 crores of vaccinations. This is obviously central to our economic recovery and to our public health. And the fact that we have been able to undertake such a massive exercise in such a short time is due to the vision and even more the motivation provided by Prime Minister Narendra Modi. From the external affairs perspective, what this means is that Indians will have a much easier and freer access to the global workplace. It would also mean that more people from abroad would come to India, adding to our tourism flow, reviving our services, and contributing to our economy. So this milestone is indeed a great achievement, and collectively as a nation, we should be proud of what we have achieved.
I would now like to invite Dr. Amir Ahmad, President Indian Doctors Forum, to come to the podium and deliver his remarks, please. Welcome, Doctor.
Honorable Ambassador of India, Shri C.B. George, Madam Joyce C.B., ladies and gentlemen, Islam health-related programs. October is the month of breast cancer awareness. Breast cancer is the commonest cancer among women. It is a cancer that can be prevented. It's a cancer which, if detected early, can be fully cured. That is the basis on which we have organized this medical campaign to pass on this message. Today we are blessed. We have an expert panel of doctors who will take us to the various dimensions that are associated not only with the breast cancer, but because the audience is largely female, they will touch upon few other women diseases. While I was sitting down over there, I was so happy as an Indian when Honorable Ambassador announced the achievement that we Indians had the honor. 100 crores, not a small number. One followed by 9 zeros, 1,000 million, a billion. All of you should feel proud about this. All of you should pass on this message, not only to your fellow Indians, but to nationals of other countries. We have to project this. We have to inform the world around the progress and the achievement that we Indians have done. We have to feel proud about this. As far as COVID-19 is concerned and this vaccination program is concerned, again, IDF had the privilege, at least over here in Kuwait, of promoting the vaccination program. In 14 different languages, our doctors presented video clips encouraging, getting registration and encouraging everyone to get vaccinated here in Kuwait. We also had a symposium where the importance of COVID-19 vaccination was highlighted. I have many things to say, but we are all assembled over here to listen to our team of experts. So once again, on behalf of the Indian Doctors Forum, Your Excellency, we are very happy, we are thankful, we are very grateful to the Embassy for giving us this opportunity to be able to reach out to our public. We used to do this on very frequent basis, pre-COVID era. Hopefully that COVID pandemic is over and we are once again able to go out and reach out to the public. And during the COVID period, it was this embassy, platform of the embassy, which allowed us to still be connected and reach out to the public. Thank you, Your Excellency. Have a good day.
Thank you, Dr. Amir Ahmed, for your informative remarks. We'll now be having presentation of a memento to celebrate this historic milestone. This is a token of our gratitude and appreciation to our healthcare fraternity, whose selfless service has been saving our lives and that of our loved ones. To do the honors, I would like to invite His Excellency Ambassador of India to Kuwait, Shri C.B. George, and Madam Joyce C.B. to come to the dais and present the memento to the IDF fraternity. May I invite the office bearers of IDF, led by the President, Dr. Amir Ahmed. Thank you, Excellency. Thank you, ma'am. Thank you, doctors. With this, we come to the end of the first segment of today's program. For the second part of today's event, I would now like to invite Dr. Sajna Mohammed, Vice President, IDF Kuwait, to the podium, who will be the MC for the rest of the program. Thank you, everyone. Over to you, Dr. Sajna.
Thank you, Mr. Fahad. Assalamu alaikum, namaste, and good afternoon, one and all. The year 2020 was a remarkably difficult year, not only because of the pandemic, but because of the fact that people all over the world were forced to contend with the new normal. We in the medical profession were posed with risks and threats of a magnitude that we never imagined, along with an added responsibility to find a quick solution that was not only effective but safe as well. When one is faced with such a dilemma, he or she has only two options, either to get bitter or better, and we decided to get better. With the onset of the year 2021, we were successful in not only treating the disease, but also finding a reliable vaccination to prevent it. In the midst of all these challenges, our responsibility and dedication towards other diseases and disorders stood unabated and undeterred. While we were battling an unknown and unseen enemy, we still forged ahead and continued our commitment towards breast cancer awareness, though not physically, but virtually. And as Dr. Amir said, Madam Joyce was the one who inaugurated a virtual event, and that set the ball rolling. Today, once again, while we celebrate the accomplishment of 1 billion vaccination doses in India, we simultaneously continue to undertake our task of creating breast cancer awareness, primarily for the fact that early detection is the only key to a complete cure. On behalf of the office bearers and the executive committee of the Indian Doctors Forum, it brings me immense pride and privilege to welcome you all to the Breast Cancer Symposium 2021. Breast cancer awareness is undertaken every year in the month of October across the world. It is only certain kinds of cancer that gets a whole month of consideration and awareness dedicated to itself, as it is extensive enough to be taken seriously. The sole aim of this awareness is to increase attention and support towards the early detection and treatment. Breast cancer is the most common female cancer worldwide, and India representing nearly a quarter of all cancers in women, where advanced stages at diagnosis and rising incidence and mortality rates make it essential to convey cancer literacy in women. The sad truth is that breast cancer knows no boundaries, neither can our nation's efforts stop it. Beneath the pink t-shirts and pink ribbons lurks a silent threat that is not only hard to detect, but harder to contain and extremely life-threatening in later stages. If not diagnosed and combated in time, it can run havoc through your body and cause extreme mental anguish. The sea of pink stirs mixed emotions, a twinge of sadness because of what this color has come to represent, lives lost and lives changed in drastic and dramatic ways because of breast cancer. But it also gives a sense of joy and pride because every speck of pink represents victory and hope for the future. All of us here today know someone who has breast cancer or who has survived it or who has become a victim. This is reason good enough for all of us to unite and support this worthy cause. As long as there is a reason to wear pink, there should be a reason to take action and to raise awareness of this silent killer so that we can eradicate the root cause that poses a threat to survival of women. This campaign should speak to our conscience so that we can join hands and ensure all women can enjoy the extraordinary gift of a long, happy and healthy life, as early detection remains the key. Hence, we are passionate about helping everyone know about breast cancer detection, prevention, treatment, and support resources. We continue to believe that with knowledge comes empowerment, with community comes inspiration, and with support comes hope. Any organization is only as strong as its dedicated team members. I welcome the specialist team of doctors who are experts in this field for giving us their valuable time to empower the community with their knowledge. We hope that this symposium and panel discussion on breast cancer awareness gives everyone the knowledge that is so very necessary to deal with this disease and also empower us with the strength needed to go through this journey. With this said, I would like to welcome each and everyone in the audience. Madam Joyce Sibi and our patron, who is our patron, media personalities, esteemed doctors of IDF, respected teachers of renowned schools in Kuwait, our fabulous volunteers, both doctors and nurses, as well as all those who have volunteered themselves to join the screening camp in this humanitarian exercise of spreading the word of awareness. We further reaffirm our commitment to saving women's lives by raising awareness about breast cancer. Jai Hind. Thank you. I would now like to call upon our panelists in order. Dr. Madhu Gupta, who is the chairperson and moderator for today's symposium. Dr. Madhu Gupta, MD, MRCOG, FRCOG, consultant gynecologist, Farvania Hospital, specialized in laparoscopic surgeries and pre-treatment of early precancerous gynecological problems. She is actively involved in national drive for regular pap smear. Dr. Susovna Sujit Nair, medical oncologist working with Department of Oncology, Breast Unit, KCC for last 11 years, involved with systemic treatment of breast cancer patients with chemotherapy, targeted treatment, immunotherapy, and hormonal treatment. She dedicates her spare time spreading the message of breast cancer awareness and screening examinations to help detect cases at an early stage where rates of complete cure are higher. For this, she was bestowed upon the prestigious Nari Udyami Award at Pravasi Bharatiya Divas in 2019 in Varanasi, during which IDF was bestowed upon the Pravasi Bharatiya Award as well. Now I'd like to invite Dr. Tasneem Amir, MD Specialist Pathologist working in Pathology Department of KCC since last 22 years. She's the First Lady of IDF, wife of our President, Dr. Amir Ahmad. I would like to welcome Dr. Rifat Jahan, MD FACP, working as a medical oncologist in breast unit in Kuwait Cancer Center. We also have with us today Dr. Tasneem Jaswi, a senior specialist OBG working in MOH from the last 12 years. She does community service through camps, screening sessions, and seminars. We are all proud to have you on board today.
Hello. Hello. May I have the voice, please? Can you raise a little? A very good afternoon. We are gathered here to address a very important issue, awareness for the breast cancer. What does awareness means? Awareness means see it better, treat it better, right? That's the awareness is. So before I start, I want, on behalf of my specialist panel, to extend the warm regards and greetings to His Excellency, Ambassador of India, Shri C.B. George, Madam Joyce C.B., President of India Doctors Forum, Dr. Amir Ahmed, other distinguished dignitaries, dear doctors fraternity, lovely audience, media representative, and the supporting staff. Breast cancer is a common cancer. It has been stated twice by our ambassador as well as our president, Indian Doctors Forum. If you ask me what is the chance of having the breast cancer, so I will say every woman has chance 1 in 8 of having the invasive or advanced breast cancer. So why to go to that stage? Let's pick up earlier, because the early pickup, early diagnosis and treatment offers complete, and I repeat and re-emphasize, the complete cure. And that is the focus of today's talk in all our discussion. I'm so fortunate to have the specialist panel from Kuwait Cancer Center, from pathology, fraternity, and gynecologists, including me. So let's proceed the journey now. So my first question goes to Dr. Tasneem Jasfi, who is a gynecologist and seeing the patients, women patients regularly. Suppose a woman comes to you with some concern about her changes in the breast. How do you address it?
Thank you, Dr. Madhu, and I am very much pleasured to be here today with esteemed panelist. Yes, when such a lady comes with complaint, I'm really happy that she is overcoming her fear and hesitancy, and she has come for checkup. So, such changes in the breast can easily be picked up by women herself during self-breast examination. Self-breast examination is a screening test. That means it is applied to all healthy population, those who do not have any complaint. During
So you mean to say every woman should do a regular breast examination?
Exactly. It is advised for all the females who are above 21 years of age to do it on a monthly basis. She should do it after her periods, not before or during her periods, because during that time breasts are painful and there are changes which are confusing. If she has attained menopause, she can fix one date of every month and she can do on that particular date. This is advice because she has to be familiarize herself how normal breast feels like. So anytime if there is a slight of the change, she can pick it up easily and in early stage when the disease is totally curable.
So if you are talking about the changes, what she should look for exactly in the breast?
She has to look for, is there any lump on the breast, any skin changes like it has become hard at some place, or there are changes in the nipple which are very important. Any of the nipple, if it has gone inward recently, is there any blood discharge from it, or there is any wound which is not healing from long time. And she must look into her armpits also because that is also important to see. After this session, we will have a detailed session with Dr. Susovna. She will teach us how to do it in a proper way.
Excellent, Dr. Tasneem. So what we learn from now is that every woman should have the regular monthly examination of the breast, and techniques will be how to do it in correct way and what to look for will be told after the symposium by Dr. Sushovna in details, so that we all learn today. We don't go home without learning how to do our self-breast examination. Thank you so much. So once we do our self-breast examination, what do you recommend the woman to do further?
Yes, suppose a woman comes. Most of the time they are not doing self-examination, so they are not aware of abnormal changes. So when she comes to me, mostly I find they are just normal. So I console them and I tell them that please do self-examination in future on a monthly basis. And in very few patients, I find there is a swelling or abnormal change. I assure them that in most of the time, 80% of the cases, they are not because of cancer, but they need further evaluation. So she should not be afraid of, but it should not ignore it also. And I refer such patients for a mammogram.
Thank you so much. And here we have our cancer specialist, Dr. Rifaz Jinan. So can you please tell what is mammogram is, what exactly the mammogram is? You just speak, it will come to me.
Thank you, Dr. Madhu. It's a privilege to be part of this awareness campaign. And being a breast oncologist, I always love to create awareness among our population. And being a woman myself, it's a prestige. As rightly told by Dr. Tasneem, the first very easy examination is self-examination, followed by a diagnostic tool, which is mammography. And what is a mammography? It's a simple X-ray of the breast tissue.
But I heard that it's painful because many patients, if you give the request for doing the mammogram, they listen from their friends or family members, anybody, and they say, oh, it creates a lot of discomfort. So is it painful?
It's a real apprehension among all the women folk. Let me assure you, it's really a very painless procedure. Just a little discomfort because your breast tissue is being compressed between the two plates of the X-ray. That's it. That's it, no pain.
That's very true, and I'm sure many of us have experienced it's just a discomfort. It's not really a painful, especially the new machines which has come up gives the least discomfort. It's not a pressing it because their pickup rate is very specific and very high. Now the other thing is what age do you start doing the mammogram? And when you think the woman should stop doing the mammogram, can you please focus on that?
The recommendations are every woman more than 40 years of age, between 40 to 50, between more than 40 should go for annual mammograms, and between the age group of 40 to 50 should go for annual mammograms every 2 years. Mammograms every 2 years. And patients who are younger can go for ultrasound of the breast.
What about, okay, so after 40, suppose the patient has a family history of having a breast cancer in the family, mother, sister, or auntie. What the same protocol is followed?
That's a very good question. Usually they should start 10 years earlier. So if the normal recommendation is 40 years, they should start right from 25 to 30 years.
Right,
Their
right,
annual
yes.
screening. If they are young, so they will go because the breasts are dense, so they should go for ultrasound of the breast.
So that's the value. Self-breast examination should be added with the annual mammogram after the 40 years of the age. Before that, if there is an abnormality, the ultrasound is preferred way of scanning it and doing it. That the clinician will decide how to go ahead with that. Now, what report is expected? Because I have seen a sort of report. I want you to explain when the woman gets a report, they are a bit confused about Birat's grading. Can you please tell about that?
It's a very easy grading system of radiological assessment score. So any patient who does a mammography, always it is augmented with an ultrasound of the breast. And we have a scoring system which differentiates the suspicious lesion from a non-suspicious lesion. So we have a grade 0 to 3, which are highly non-suspicious lesions, and we don't need to do anything for them. And when your radiologist has reported a lesion of 4, or 5 or 6, they are highly suspicious lesions. That means there are changes which warrant diagnosis, and for that we can ask for core biopsy to establish the diagnosis.
Oh, that's a great assurance. So each thing which was felt in the breast, not all the time is a cancer. After the self-breast examination by a specialist and doing the radiological evaluation, we come to know to some extent that this mass is non-cancerous or benign, which what to say, or other can be the suspicious lesion. These suspicious lesions need further confirmation, and here comes the role of take biopsy actually. And I have the First Lady of the IDF, Dr. Tasneem Amir, with me, who is a consultant pathologist in Kuwait Cancer Center itself. So, Dr. Tasneem, what is biopsy?
First of all, thank you, Dr. Madhu. And I'm extremely privileged to be a part of this panel. And coming to the biopsy part, biopsy is a sample of tissue that is taken from the body to be examined closely under the microscope and to give an opinion whether the lesion is a benign lesion or a malignant lesion. Malignant means cancerous lesion.
Oh, so biopsy means simply taking a sample specimen from the lesion and examining in details under the microscope. Great. The problem is now, first of all, the first scaring goes with the woman once they do the mammogram. Is it painful? So definitely it is not painful. Here comes the another stigma that I want women to know. Is it a painful procedure?
Not exactly painful. We do numb the area with either an anesthetic gel, cream, or if needed, if it is a bigger biopsy, with a local anesthetic injection.
So it's not painful, actually. The area is numbed and you just go to take a biopsy. Apprehension is more, actually. Just relax yourself. Area is numb and the tissue is taken. So can you tell us little more details about the biopsy, how it is taken, the biopsy is taken?
Yeah, there are different types of biopsy. But in the case of breast lesions, we do 3 types of biopsy mainly. First one is the FNAC, that is a fine needle aspiration cytology. That is usually where I work and I do it on a daily basis. We just take a small syringe with a needle and pass it to the lesion and take out the sample and examine it under the microscope. And the second one is the core biopsy. Core biopsy, again, we use a needle, but it is of a little bit wider gauge, and tissue is removed in this case. That is generally done by an interventional radiologist. And the third one is an open biopsy, which is done by the surgeon in the operation theater. Whatever be the biopsy, we get a tissue which is processed and examined under the microscope to determine whether the lesion is a benign lesion or a malignant lesion.
So
and in case of breast lesion, if it is malignant, we go ahead and do the receptor studies in the same setting. That is the estrogen receptor, progesterone receptor, and the HER2/neu, because that is very important for our oncologist colleague.
Correct.
To plan the treatment.
Thank you so much. So see how crucial is the role of pathologist as adding to the whole picture of what's going on with this lesion. Thank you so much. So most of the time the biopsy is a OPT procedure, just numbness and one needle or a small cord that you don't feel it at all. So how long it takes the biopsy result to be out usually?
In our center, usually we give the report in 48 hours time. We don't delay the breast cancer cases.
Oh, that's great,
Yeah.
because
With
the woman has
receptors.
anxiety once she is undergoing through that how long it's going to reveal that how long it's going to be.
Yeah.
Okay. So what will happen after the biopsy is either it is just a benign lesion, which need to be followed or not to be followed. And in some cases where will be cancer, so those cases will be referred to again to the cancer specialist team. And here we have another person from Kuwait Cancer Center, Dr. Sushovna Nair. Dr. Sushovna, once the report comes to you or referred to you with the proven cancer by biopsy, so how do you now plan your further proceedings?
Good evening. Thank you so much, Dr. Madhu, for that question. Once again, as my all panel members said, all of us feel highly privileged today to be on this stage speaking on a topic like cancer, that too breast cancer specifically, which we can pick up early. Really, that patient will have a normal life without the fear of death from cancer. So let us all join this campaign with a true sincerity. Now, coming back to the question, once we have a proven diagnosis that it's a cancer, as Dr. Tasneem Amir, our pathologist, has said, from the biopsy, we find out that there are receptors, ERPR hormonal receptors and HER2/neu receptors. Cancer treatment, actually, it's a treatment which needs multimodality of team. Like every case needs different medical specialists like medical oncology, surgical oncology, radiation oncology, pathology, and radiologists. So we have something called multidisciplinary team meeting in KCC, where each case is being discussed, and so that we can come out with a final plan which will be best for that patient. Because every cancer patient is an identical case. We cannot generalize the treatment. And when we discuss the case in a multidisciplinary team meeting, we come out with the best option that will give the best prognosis.
Oh, that's great, actually. So, because at the first meeting you are seeing with the multidisciplinary team from each specialist which can be collaborating to have a plan of management in this particular woman. Now, how long it takes the first appointment to be taken? How long patient has to wait after the biopsy result?
Yeah, actually in cancer diagnosis, as we know, the treatment should not be delayed. KCC, Kuwait Cancer Control Center, being the only cancer hospital in full Kuwait, we are really overloaded with cases because whichever case is being diagnosed in any part of Kuwait will reach us for treatment. So we are trying our level best to see that no case is delayed more than 2 weeks. Maximum within 2 weeks, the case gets streamlined and planned for further management.
Oh, that's great, actually, because this is the only center in Kuwait. But the service is very streamlined, what I know as a perspective of a consultant gynecologist. Once the case is suspected, mammogram done, biopsy, and going to seeing the cancer specialist panel team, I think 2 to 3 weeks, total time period, probably. Yeah, that's a good one. So once she has seen it, how do you further work up to know more about the disease and plan the management, Dr. Sushona?
Yeah, so actually for cancer treatment, we need basically a staging workup. Staging workup means we do scans like CT scans, or nowadays we are doing PET scans, which will diagnose whether the case has gone anywhere else. The cancer has traveled to some other part of the body like lungs, liver, brain, bone, or any part away from the breast. Till the time the cancer has not got spread to distant organ, we take it as an early breast cancer. It may be up to stage 2 or even stage 3. Why do we do staging? If the case is like stage 2 or stage 3, our treatment intent is called curative intent. We have a planned protocol treatment and we expect that the patient will come out of cancer. Unfortunately, if the patient who comes to us, an initial staging workup shows that the cancer has already got disseminated, it has got a small spot in the liver or lung or somewhere in the bones, then we call it stage 4 disease. And the unfortunate part of stage 4 disease is our treatment never ends. It keeps going one after the other. So as we are discussing here, importance of early diagnosis, so we try to discuss here basically on the early diagnosis, stage 2 and stage 3. So staging workup helps us to plan our treatment further.
So most of the time, if appropriately screened and biopsied in a earlier time, probably is having the total curative intent, and that's today our emphasis is on. Because our audience is there, and I'm sure we all must have seen the breast cancer case in the family or the friend, and they may be having many queries. So for that reason, I will like to ask, once we start the chemotherapy, sometimes the chemotherapy is started before the surgery, sometimes started after the surgery. What is the idea behind how do you select those patients?
So basically in cancer treatment, surgical management is the main modality of any cancer treatment, that is removal of the tumor mass. Now when we add chemotherapy or hormonal therapy or targeted treatments, we are trying to help the surgical outcome in a better way. There are some biopsies, as Dr. Tasneem Amir said, like the receptor status, the grading of the tumor. In our multidisciplinary meetings, we decide this patient will benefit from chemotherapy before surgery or we will give chemotherapy later. So based on the pathological finding, the immunohistochemical studies, we decide if the tumor is very aggressive variety, and if it is really big, we give chemotherapy prior so that the tumor can be reduced in size and the patient can be protected from not going for a mastectomy. We can preserve or conserve the breast. She may land up in a only lumpectomy, removal of the tumor mass. So chemotherapy basically we give to downsize the tumor, to reduce the size of the tumor. There are some cases like elderly patient with a very favorable, very good type of biology of the tumor from the receptor status, which will tell that the patient can go directly for surgery, and then later on we rediscuss again if patient can require some more cycles of chemotherapy. So these are the methods, or these are the situations where we decide chemo should be prior or after the surgery.
So for the audience sake, what we are discussing here to summarize is that when the patient goes to the cancer center, seen by the panel of the subspecialties to decide the mode of management, how it is being done, chemotherapy may be given or may not be. It may be before or after, depend on the individual case. That's what it is there. Just I want to say that what about, is the breast removal is the must, or we can conserve the breast? Because that's the main worry of a woman who is having the breast cancer, that I will lose my breast, I will lose my self-image and self-esteem. So can you focus on that, please?
Yeah, it's very important actually, this question, because once a lady is diagnosed with a breast cancer, the first fear that she gets is, I'll have to lose one of my breasts. Unfortunately, this is only in some scenarios. Most of the times, our motto is somehow to conserve the breast. As I said, if the patient has a aggressive tumor or it's a large tumor, then we give chemotherapy and reduce the size to conserve the breast. So mastectomy is not for all cases. Generally, we preserve the breast and the patient may land up only in a lumpectomy, that is removal only of the tumorous mass.
Okay, that's great. And suppose when the surgeon is doing the surgery, of course, the patient wants it to be completely cleared of the disease. So at least as a part of surgeon point of view, how it is make sure that the extent of the surgery is appropriate?
Yeah, on the surgical table, when the tumor is marked, there is something called inking. Then after this mass is removed, we generally send it to the pathology for giving us a urgent report inside the theater itself, whether the margins are clear. So for here, I would like to take help from Dr. Tasneem.
I think you are talking about the frozen section.
Yeah, exactly.
It's a very common term, frozen section. We also do as a general gynecologist when we have a suspicious lesion when we are doing the surgery. So what we do, we alert our pathologist from the before that such a clinical scenario is there. And during the surgery, we remove a part. And that's what they are doing. The mass is removed and it is sent to the pathologist, and they will see there and there how it is being done. So I will like to hear from Dr. Tasneem Amin, who has a very vital, pathologist's role is very vital to delineate the appropriateness of the management. So Dr. Tasneem, can you please focus on that? How do you work hand to hand when the surgeon is in the theater operating the case?
We pathologists are essentially needed during the time of surgery. The surgeons, they alert us, okay, there's going to be a frozen section going to happen. So we are all alerted. So we receive the specimen in the lab, and immediately we assess the tumor size and the margin. If the margins are clear, immediately the information is passed on to the OT. If it is close or if the margin is involved, we give the measurement and we do a frozen section and pass the message, and the surgeon will take more tissue from the margin and complete the surgery. Moreover, there is something called the sentinel lymph node. In early cancer, they want to have a conservative surgery. In that case, they inject a dye into the tumor itself and check the first draining lymph node, that is called the sentinel lymph node. That is picked up by the surgeon and sent to our laboratory, and immediately within few minutes, the sections are made and examined, and the message is conveyed to the OT. And if this lymph node is negative, then they conserve the axilla. If the lymph node is involved, then they pick up few more lymph nodes. This is very essential in conserving the axilla in the case that if the axillary tissue is completely removed, that can lead to severe morbidity like swelling of the arm. And to prevent that and to plan the surgery, we do this frozen section.
Yes, we have seen sometimes if we do extensive surgery of the axilla, the patient lands up with the swelling in the arm for the long time. It's such a limitations. So yes, your input is so important. And thank you for focusing on this particular point of the frozen section. Dr. Tasneem, thank you. So Dr. Sushomna, after the surgery is done, I'm sure the tissue is again sent to pathology for the further examination, right? Can you?
Yeah. So as we were discussing about the lumpectomy and mastectomy, there are still a few cases where we may have to unfortunately land up in mastectomy. Like if it is the tumor is growing from different parts of the breast, where we call multicentric tumor. It is not from one specific point, it's from different quadrants of the breast. In those cases, the patient have to land up in mastectomy. Otherwise, the cancer will come back as a recurrence in the local area. Also, If the patient upfront comes with a locally advanced tumor, then also the patient may have to go for a mastectomy. Now, once the surgical intervention is done, whether a lumpectomy, that is removal of the tumor only, or a mastectomy, the full tumor that is being removed is sent to the pathologist to get the final pathological staging, which will help us again to plan our further treatment after surgery.
So as very obvious, I will go back to Dr. Tasneem Amir to tell me how do you report the specimen that has reached after the surgery to you?
Yeah. Once we receive the final specimen in our lab, the specimen is sampled extensively and a final pathology report is issued. In our final pathology report, we give information such as the type of the tumor, whether the tumor is limited only within the duct or if it has gone outside the duct, whether it's an invasive carcinoma. Then if it is a case of treated case, like Dr. Susovana told, they give neoadjuvant chemotherapy prior to surgery, then we look for the tumor response to the chemotherapy. Therapy response we check whether the residual tumor is there. Then we grade the tumor, whether the tumor is a low-grade tumor, that's a slow-growing tumor, or a high-grade tumor, that's an aggressive tumor. Then also we report on the margins, where the margins are clear. And also again, we reconfirm the receptor status. Hormone receptors were studied initially on the small biopsy. We redo it and give a confirmation on the receptor status. And also we give a final pathological staging based on the tumor size and the lymph node status that is also issued. This pathology report is a very important tool for the oncologist to plan the further management.
Thank you so much. So really, a pathologist is needed during the surgery and after the surgery to give definitive diagnosis. And once now the final report is issued, and audience, you have seen how meticulously the care has been taken, and each case is different. And most of the time, if it was diagnosed at early stage, the treatment is complete at this point, margins are clear, and it is curated. But there will be some cases which needs further attention. So here is Dr. Rifat again, and I will refer the next question to her. Once the report reaches to you, how do you take proceedings further?
Pathologists are our guiding light. So once the final pathology reporting is done,
Torchlight.
yes, they show us what to do next. So all the patients, rather most of the patients, will require adjuvant radiation therapy to the breast, which has been excised, or lumpectomy has been done, and to the axilla where the nodes have been removed. That's just a prophylactic procedure which helps because whatever was seen by the surgeon has been removed. But what helps in radiation is that there are microemboli sometimes present at the surgical sites which are warranted to die after radiation. Patients, as per our pathologist reports, if the patients are hormonal positive, they may need additional hormonal therapy in the form of tablets for around 5 to 10 years. If the patient has HER2 receptor positive, then they may need anti-HER2 treatment for a year or so. If the patient sample is free of receptors and Herceptin and HER2 receptors and hormonal receptors, she may just need simple surveillance.
Thank you so much. So we, till now as a panel, we have discussed about knowing from where the suspicious was there, confirmation, management from the cases which may not have needed treatment to the patients who need a treatment and the extent, the maximum extent that it can go through. Now, in all this journey, what I'm realizing there's a lot of psychological stress is done on part of not only the woman, her husband, her family. So how this support is being provided to make this jumpy road a bit smooth, to accept the facts and get it treated completely? Can you please focus on that?
Mental health is really important for our patients and our treatment outcome. Our patients go through a roller coaster ride of emotional disturbances, anxiety, mood disturbances, so much so some patients land up in depression and denial. They don't want to go for treatment. So our first reassurance is right at the doorstep of our OPD visit. We tell them, cancer is not death. It is just like any other chronic disease. We aim for early breast cancers cure, so no need to worry about death. So that gives them some positivity. Then we try to explain them the treatment options we have, the side effects, and how we manage them. That is another reassuring point for them. Then with every session OPD visits, we make sure that the family and the patient is being counseled and looked at for her general health, how is her mental health. Unfortunately, some young patients may land up for psychological counseling and psychiatric assessment or medications. So we provide them psychiatric help with the help of our psychiatrists who are there in the OPD, and they take care of that. And last but not the least, we have very good social support groups which are being organized by our embassies also, and also at the local level in the hospital, who organize social gatherings for them, entertainment programs for them, and especially meetings with the survivors who help them motivate and go forward and look forward with positivity for the aim of cure of the disease.
Thank you. So all attempts is made as part of the health care professionals to make sure that the psychological health is being taken care of. And here also in the audience, I will just take that cancer it's not a death sentence. It is a disease like any other disease, like diabetes and hypertension and things. So please, if somebody in your family or friend has a cancer, just support them. Sit with them, support them. There's a treatment is excellent. Cure is almost complete cure in the early stage. Even the later stage also, the treatment is so good now, the survival rate is quite high.
It's teamwork. Everybody has to participate, right from the patient to the physicians, to the support groups, and more important, the families. The families have to really go along with the patient, understand what she goes through during those moments of emotional upheavals, and they need to be really like a strong support for the patient.
Thank you so much. Now, in addition to breast cancer, I will little bit, as Dr. Amir has already told, as our target audience here is the females, we need to discuss little about the screening of the other gynecological cancers as well. And which cancers we are talking about here is the cancer of the cervix, which is the mouth of the uterus itself, and the ovary. These are the three cancers that we may face, and we have the screening for those cancers as well. Now, cancer cervix is the foremost, especially in our Indian patients. The incidence is very high. So here I have Dr. Tasneem Jaswi. So, Dr. Tasneem, how do this gynecological cancer, the usual presentation is? How do they present?
Yeah, the most important warning signs of all gynecological cancers are, first is change in her menstrual cycle. Women should notice any recent change. If the cycle is heavier than before, if there is bleeding in between the cycles, or she has bleeding after intercourse, any foul smelling discharge which is long lasting. And one very important symptom, if someone has attained menopause and if she bleeds after that, she must not ignore it and must visit to her doctor. There are some vague complaints also, like she feels heaviness or pain in her lower tummy, or there is increase in size of her tummy. Sometimes there are changes in bowel and bladder habits. That means she cannot pass urine or stool properly, so she should not take it lightly. And sometimes there is nothing at all, just she feels that she is unwell. So all this can be there. One has to be aware of all this.
Thank you. Actually, these are the warning signs. That doesn't mean you have a cancer. If these are there, they can be associated with the cancer. If the bleeding disturbance does not has cancer, let me assure all of you. But this can be one of the signs. So it's better to, if any of these symptoms you or your friend or anybody in the family has, so please go to the gynecologist and to get it sorted rather than waiting for the spontaneous course. Now the thing is there any way that they can do regular checkups to get it sorted earlier, Dr. Tasneem?
Yes, Dr. Madhu, we recommend at least once in a year visit of every female to a gynecologist, where she will have her risk assessment. If needed, she will ask for transvaginal scan, supplemented with biopsy or tumor markers. So everything will be ruled out in a very early stage and she can live happily.
So even if you don't have any symptoms, it is recommended that every woman should visit the gynecologist at least once in a year to do a basic checkups, and this rules out not only the cancer, maybe the other problem also that you are not aware of, which can be easily treated and you can be cured. Thank you so much. And now I will extend more about the cervical cancer, which is a second most killing disease in India. So, Dr. Tasneem, is there any way to do a screening? You have very well told the screening for the breast self-examination. Is there any way we can screen for the cervical cancer?
Yes, Dr. Madhu. Cervical cancer is one of the few cancers for which we know the cause of it. So nice that it is caused by a virus known as human papilloma virus or HPV. It is transmitted sexually. So the good thing is it takes long time from the infection to the development of the cancer. So we have ample time to diagnose the cancer in pre-cancer stage. That means the woman does not have any complaint. And it is done by a screening test. I think everyone must have here heard of it. It is known as pap smear. So it is very effective test which is done from many decades now. Women has to visit her gynecologist when she is not in her periods or her period is not due in 2 to 3 days.
Excellent. So this is another way of screening it. So in addition to your self-breast examination at a monthly regular basis, the regular smears are also required as part of the health checkup for gynecological cervical cancer. Now, what age they should start doing this screening, just a smear, how frequently they should do it, and when they should stop it?
Yeah, it is recommended that every female should start pap smear at the age of 21 years and should repeat it every 3 years. In some centers, it is added with HPV testing, where they can see the virus also. So then it is repeated every 5 years.
So it started from the age of 21 years, and till how long you want to continue?
Till age of 60 years. If her previous 3 smears are normal, then there is no need of doing it further.
So it's recommended for every woman after 21 years of the age to do a regular screening at every 3 yearly and stop at the age of the 60 years if your last 3 consecutive smears were normal. So if somebody has not done, please get this opportunity. In Western countries and in India, some parts, this is a national program to do a cervical screening. In this part, it is not a program. It was thought to be, but still it is not implemented. Opportunity screening done sometimes once in a 5-year or 6-year does not help, because in that long journey, we may miss some lesions that we would have treated earlier and get rid of the disease. So a little about how do you do it, and then how do you do the sample?
Yeah, pap smear is a very simple, painless OPD procedure. It just takes few minutes. If you can devote few minutes for yourself, you will save yourself from lot of future troubles. And it is done in the same manner as a normal gynec exam. With the help of speculum, the mouth of the uterus is seen and the cells are collected from that with the brush and put in the bottle which contains the solution, which is sent to pathologist for further reporting.
So here again comes the role of the pathologist. So Dr. Tasneem Amir, so can you tell me how do you report these cervical smears once they come to your lab?
Yeah. We report the specimen received from our gynecology colleagues. We report it under 3 major categories. One is normal smear, like within normal limits, there is no malignancy or atypical cells. Then the second category is the abnormal cells. That is a precancerous stage that will show an abnormality ranging from mild, moderate to severe abnormality. Then the third is the frank cancer. So the significance of this pap smear is that the cervix produces this abnormal cell about 10 to 15 years prior to the actual onset of cancer.
It's a long time, long interval.
Yeah. So if you do a regular pap smear test at a regular 3-year interval, then you get the window of opportunity to catch this at an earlier stage, and a gynecologist can cure or treat this with minimal intervention.
Thank you. You have picked up my most favorite area of work now. It's because I am the one representing, I think, from Kuwait or my hospital treating these lesions. So what happens is when the report comes, as she told, there are 3 categories. The number 1 is normal. If it is normal, they go back to their routine screening, the 3-yearly screening. The second, the extreme will be the cancer. Then that case will be referred to our cancer team in the Kuwait Cancer Center, who will plan the further management. Will not discuss further because of the time constraint. The middle is the abnormality, mild to severe, mild, moderate, and severe. Most of these abnormalities, they are because of simple infection. So what we do, we just take a swab, confirm infection, treat it, and it is gone. So you may require few more smears in between just to confirm that this has been cleared off. Some will be moderate to severe, where we need additional examination by colposcope or by microscope, that we do it. We take a biopsy, we confirm, and we just treat it with very simple excision of this abnormal tissue, because we have enough time further. So even suppose if you have missed one appointment at 3 years, 3rd year was your appointment, you missed it, you can go after a few months, next year, but please do not prolong further. It is so easily treatable, the cervical cancer. And we can reduce the burden of cervical cancer from our country especially a lot. Now, there is something about Dr. Tasneem, we heard about being the word free of the cervical cancer. How? To give vaccination programs. Can you tell about that, please?
Yes, as we know now that cervical cancer is caused by a virus. So luckily we have a vaccine that can prevent it. So this vaccine is now used from past 15 years, and it is found very safe and highly effective. It can prevent infection in up to 97% of the ladies. It is recommended for all the girls and women between ages 9 to 26 years before marriage, preferably at the age of 11 to 12 years. If she is younger than 15 years, she has to take 2 doses 6 months apart. And in females older than 15 years, 3 doses at 0, 1, and 6 are given, and she is really has been protected with this deadly disease. Now suppose someone is married and she wants to have this vaccine. So before taking vaccine, she must do HPV testing to rule out the infection. If it is negative, she can take it also. And if it is positive, there is no sense in taking it because it will not prevent any infection now. So it will be a great thing if before 13th birthdays of our daughters, if we can vaccinate them and give this gift for being a teen.
So there's a lot of stigma about this vaccine. It has been since long in the market, and it has been given very effectively in the Western countries. It's a school program. My 2 daughters have received the 2 vaccines at the age of 11 and 12. And as Dr. Tasneem rightly said, it's the best gift you can give to your first teenager, 13, to your daughter, to give the 2 vaccine and protect her 95 to 97% for developing the cervical cancer. So really a great achievement, and I recommend and I really want you to consider and do this initiation at your level. Thank you so much. Now, till now we have discussed about the early diagnosis, treatment, management. Dr. Sushovna, who better than Dr. Sushovna can tell? Number one question, what is the importance really of the early diagnosis and the treatment? And what preventive, let me put the both questions together so that you can take your own pace to answer. So what's the importance of the early diagnosis and treatment? And second, what else we can do to prevent us having the cancer before it starts developing it in our body?
Thank you so much. Those are really two very important topics to be discussing today. We all have gathered here to. The fear of death from cancer again is also only related to metastatic burden of disease when the cancer is stage 4. All of us have to understand that early cancers will never cause death. This is very important. Also, as some of my colleagues said before, the term cancer, neither it means death, nor death from cancer is so easy. Yes, it does decreases the quality of life of the patient because of the treatment side effects and the depression that she goes through. But if the same cancer is diagnosed early, she or he, I should put one line here, breast cancer is not limited to only ladies. 1 to 3% of breast cancer patients are males. So, breast cancer screening or campaign, it's not only related to ladies, it's also in males. So now, if the same patient is diagnosed early, he or she will never have a fear of death from cancer. So that is what we are more inclined to know about. What happens? Cancer development is always at the cellular level, starting from the cells. Cancer generally grows silently in our body without causing any symptoms. So, by the time it is clinically palpable, by the time we can make out there is a small nodule or a growth or a mass on the breast, it might have been growing in our body for quite long time, sometime even couple of years. When we keep a mass growing in our body, neglected or undetected for long time, the unfortunate thing that happens it can travel through the liquid channels in our body, the blood or the lymphatics. There are two liquid channels which is circulating all throughout the body. Once the cancer cells go into the liquid channels, though they may not be picked up by our scans immediately because they are so small, but they can go and get themselves deposited in some distant organ like liver, lung, bone, brain, lymph nodes, anywhere in the distant part of the body. They keep growing. They form a nidus there and keep growing. These cancers actually, they come back later, 5 years, 6 years later, and then we pick them up by the scans during our follow-up checkup, and then we tell the patient that unfortunately that she or he has come back with a metastatic disease, that is stage 4 disease. So, that is only the bad news. So all of us have to understand here, to get diagnosed with a cancer is not the fear. The fear is to get a recurrence or cancer coming back, because when it is back, stage 4, our intent of treatment changes to something called palliative intent. Means we are not able to take off the cancer from the body anymore. The patient lives or dies with cancer because somehow or the other the patient's general conditions keeps deteriorating. So let us have a vision today that why not think that if I am going to a patient of breast cancer tomorrow, why not pick it up today and get a full cure which will not allow the cancer to come back. Also, you have to understand that screening programs or screening camps does not prevent cancer. It only helps you to detect the cancer early, whereby you have a chance of a complete cure. I come to the second question now. What are the preventive aspects? Yes, in cancer management, we don't have any magical cure. God willing, we have some day where we get really a magical cure and we just do something and the cancer goes up from the body. What we have as a magical cure is our health style, the lifestyle. You can take it as bullet points. It is very important to reduce the risk of cancer that we have to have a healthy eating habit. Those who are smokers, please stop smoking because smokers are risky to have 50% or 50 times higher risk of developing cancer compared to a non-smoker. Alcoholism, again, that is another notorious culprit spreading or starting the process of cancer in the body. Not only breast, different parts of the body. How do you cook your food? Red meat, if it is barbecued or roasted, generally it again changes into a different chemical form, which again has the tendency or potentiality to initiate a process of cancer. So, limit your intake of processed meat, especially barbecues, especially for the kids. Also, you have to understand that in our books of oncology, they say cancer cells cannot grow in oxygenated environment. If there is lot of oxygen around, cancer cells will not get an environment to grow. They generally die. So, how do we oxygenate our body? Try to have a walk, a brisk walk, maybe 4 to 5 days a week, at least 20 minutes to half an hour, preferably in a green, say a garden or a park. It should be a brisk walk because studies have also shown that all the toxic agents that we gather in our blood or in our body because of the different things that we are exposed to, the exhaust gases from the vehicles or the cosmic radiations that we are getting on our body, all these toxins can be get rid of if we sweat. Sweat not by heat but by physical activity. Those ladies who are taking contraceptive pills or postmenopausal ladies who are taking hormone replacement therapy, please talk to your gynecologist if you can go for some other method of treatment, because hormone replacement again increases your hormonal level, especially the female hormone, which again increases your risk of developing a breast cancer. Healthy lifestyles also include your fruit and vegetable intake. Increase your amount of fruits that you take. See at least 5 to 10 servings of fruits and vegetables daily. Routine intake of vitamin D also helps to make your cells more immune against cancer development. Above all, there is nothing beyond prayers and keeping your positivity intact. So, as in the beginning we said, that self-breast examination is very important because nearly 80% of the cancers that are being picked up by ladies are by themselves. They are the ones who are picking it up. But the only thing is that many a times they are picking it up late. So by daily examination, once you do a regular examination of your breast, you may pick up the early changes at a very initial stage where we can assure you as clinicians to not get the cancer back again, though you may have to go through the treatment.
Thank you so much. You have explained in very details to the audience, and I'm sure they must have taken this in the notes, that what is the prevention that of not getting the cancer. I'll just want to add one more line about the taking the hormones. In addition, now giving the hormones is becoming very less amongst the doctor, but there are a lot of pharmacological companies in India or here. They are selling off low estrogen, some estrogen sort of things, formulations in the market. Please don't take that. We don't know what doses and how much they are harming your body. So I will add to that one. Thank you so much. We know the prevention is always better than cure. And here we should say this is a month of October, a month of hopes and reassurance. Pink color denotes restating and re-emphasizing early diagnosis, early pickup, timely treatment, and defeating this devastating disease. Let's all take a pledge that from today onwards, no woman in the world, or here at least, whom we are able to address should die of the breast cancer. Thank you so much, the lovely audience, to be here and patiently listening to this discussion. Mic back to Dr. Sajna.
Thank you, dear panelists, for a wonderful, enlightening session covering most of the important aspects of major concern by the women here. If anyone in the audience has any specific questions for the doctors, we would be happy to share their numbers so you can contact them later. I now invite Ambassador Sir, Madam Joyce, Dr. Amit on the dais to please give a token of appreciation to the panelists. I call upon Dr. Madhu Gupta, the moderator of the session. Dr. Susomna Nair. Dr. Rifat Jahan. Dr. Tasneem Jasvi. And our First Lady, Dr. Tasneem Amir. I now request everyone for a group photograph, please. I now call upon Dr. Aarti Chadda to deliver the vote of thanks. Following this, I request all the male members present in the auditorium to... Okay, prior to that, there's a photo session with all the nurses present here who have come as volunteers for the screening camp.
A very good day to all the dignitaries, my dear friends, my colleagues, and all the friends sitting in the audience. I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion. Let me first of all start by giving glory to the Almighty God for making us all part of this campaign, which is beyond doubt going to be of resounding success. Cancer is tough, but so are we. So we stand united. Raising awareness of the scope and seriousness of this disease is one of the most important and impactful functions of the breast cancer awareness campaigns. I will start with my vote of thanks with our never-ending gratitude to one and only His Excellency, Shri C.B. George, Ambassador of India to Kuwait, for always being the keen pillar for arranging and organizing such worthy camps along with his dedicated and hard-working team at the Office of Indian Embassy. Beyond doubts, the much-needed valuable thanks goes to Madam Joyce C.B., our patron. She has always stood firmly and always supported all the social causes with us, always. Next, Dr. Amir Ahmed, our proud president of IDF, for his immeasurable contribution to the office as well as to the society. I would like to thank our panelists, the esteemed doctors, Dr. Madhu Gupta, Dr. Sushovana Sujit Nair, Dr. Rifat Jihan, Dr. Tasneem Amir, Dr. Tasneem Jasmine, for enlightening us with the pearls of wisdom we all needed today. Thank you for being dedicated, thoughtful, and compassionate doctors you all are. You all have gone above and beyond for a healthy outcome for our society. Thank you so much to our esteemed doctor colleagues who have volunteered to lend us a helping hand for the campaign today. I would like to thank Dr. Saroj Grover, Dr. Shamima, Dr. Tasneem Amir, Dr. Tasneem Jasween, Dr. Preetha, Dr. Asha, Dr. Sana Khan, Dr. Sabita, Dr. Nilofer, Dr. Bhavani, Dr. Renu, myself, Dr. Aarti, Dr. Nalini, Dr. Gillian, Dr. Murli George, Dr. Tapkera, Dr. Sajna Muhammad, Dr. Sushovana Sujit Nair, and Dr. Sujata. Once this program is over, we'll be following up with our breast awareness camp. I would like to also pay my gratitude to Mr. Sriju, President of Indian Nursing Federation of Kuwait, and to all our nursing staff. If you are here, then only we are here. Thank you so much, Dr. Tehseen Khan, the President of Indian Women Association, for always standing with us for all the noble causes, for helping our society. A heartfelt gratitude to all the media representatives and their supporting staff, and all the volunteers from all the teachers, school teachers, or organizations who have come forward for this noble cause. I will leave with the inspiring quote by King Martin Luther. An individual has not started living until he rises above the confines of his individual concerns to the broader concerns of all the humanity. Thank you so much for all coming. Have a wonderful evening.